Pune-based Genova Biopharmaceuticals, a subsidiary of Emcure Pharmaceuticals, is working on India's first mRNA-based vaccine for COVID-19. Genova has received funding from Department of Biotechnology and plans to start Phase 1 clinical trials in October 2020.
For COVID-19 vaccine, Genova is using next generation technology which combines mRNA and adjuvanted nanolipid carrier. This vaccine will be very low dose injectable, sustained release due to its self-amplifying mRNA platform. This will ensure safe and efficacious vaccine.
The advantage with Genova's mRNA vaccine is that it is rapidly scalable. So Genova can tap into the vast specialized nanoparticle capacity that has been already created at Emcure sterile parenteral sites to make close to 200 million doses. Additionally, our team is already partnering with different OEM manufacturers to install 1 billion doses capacity.
Led by the visionary founder Mr. Satish Mehta, who has given many innovative and first in India products to the country. Emcure is committed in its fight against COVID and is working towards Swasth Bharat, Atmanirbhar Bharat. Jai Hind.
Good afternoon and warm greetings. I am Dr. Omkar Swami on behalf of Emcure Pharmaceuticals Limited. Welcome you all in this very exceptional program of Proxym XT, Icons of India. In this critical time, apart from being your trusted healthcare partner, Emcure is in forefront in advanced research on mRNA COVID-19 vaccine, latest in its kind, priority responsibility for serving the society. We are Emcure, presenting you once in a lifetime experience to meet the icons and the gurus of the medical fraternity. I would like to extend my deep gratitude to all the senior dignitaries and living legends participating in this program. It is said that wisdom is not a product of schooling, but of the lifetime attempt to acquire it. So I feel this is the most precious afternoon today and a real honor to witness such a program and gather the gems of infinite acumen. To cherish this moment, we have Dr. Sushrut Babulkar sir, who will bring out the pulse of wisdom and experience to inspire from these living legends. We feel hosting this meeting is a really great honor for Emcure, and we look forward for such events in future as well. With this, I would humbly like to hand over this session to Dr. Babulkar sir and take your pardon. Thank you very much, sir, and over to you, sir.
Thank you very much. Good afternoon, everyone. It's an absolute honor to be part of this meeting and to be able to host this meeting. We have all heard of Mahatma Gandhi. We have all heard of Amartya Sen, Romila Sen, Prakash Padukone, Amitabh Bachchan. All these icons we have heard of. We have also heard of the icons who are with me today in orthopedics, who created orthopedics era of our country. We have with us Dr. Nandu Lad from Mumbai. We have with us Dr. D.D. Tanna, Mumbai, Dr. G.S. Kulkarni from Mumbai, Dr. Shantaram Shetty, Dr. Ved Prakash, Dr. Hardikar, Dr. K.H. Sancheti, and Dr. John Mukhopadhyay. All these icons, I must say, and I must agree today, have been my Dronacharya. So, though I have not directly been their student during my postgraduate days, I have been following them since I was born, because I have been blessed to have a great father who is actually my superhero, who is my hero in my life, socially and academically. Dr. Sudhir Babulkar has been their colleague. So I have been seeing these people since I was born, since I was literally born. And so when my dear friend Samar Ghosh, Emcure, asked me that he has such an idea, I immediately agreed upon this. What better opportunity than to be teacher of teachers today? And trust me, last 24 hours, everyone sitting here have been calling me, Sushrut, what are you going to ask me? Sushil, what are you going to ask me? Sushil, what should I present? So it's been fun last 24 hours, trust me on that. With this, I have created a workflow to be able to extract why these icons are icons today, which will be a great opportunity for young orthopedic surgeons, young medical personalities who are just forming their career to listen to these great personalities, how they have achieved what they are today. May it be social, may it be academic, may it be that one case which they faced in their life, may it be that one incidence that they are cherishing all their lives. So let's bring it out from them. And to begin with, let me ask Dr. Nandu Lad. I have seen Dr. Nandu Lad since, as I said, since I was born. He was senior to my father by a year or so. And then I have seen him percolating his experience and knowledge within my father. And then he brought AO to India. Then he brought AO trustees to India and to Nagpur. And I still remember he bringing Professor Weller, Professor Holes, and none other than Rob Matthews to Nagpur. Dr. Lad, you must be remembering that, right? So that was way back. Please unmute yourself. Please unmute. So yes, it's just me and you talking for a while now. We have next 10 minutes talking to each other. So if you remember, you were the AO trustee, and then of course you got AO to India and to Mumbai. That's a great contribution by you to bring AO available even to the Science Trauma Center. So what I want to ask you is, in your eyes, we know that you have been great, you are great, but in your eyes, what is the biggest achievement in orthopedics that you think? Sir, unmute. We are not able to hear you. Okay, now.
I think greatest achievement have been my principle that in life it is not important I, the principle is we. And how do we create an enlightened fraternity of the professors and also of the students. And that's where I felt that it was very necessary that being an academic institution, instead of spending your time to grow yourself and become big, how can you create a large population of enlightened orthopedic surgeons? And believe me that whichever people I met, which I'll show you what made me my icon, I found that from each top person I had something to take. Right from what I learned in India from the material, and second, when I went abroad and saw the professors working from 6:30 a.m. to 8:30, make efforts to organize symposia, seminars, and also listen to the younger people. And what I learned, I taught, but what I learned from the feedback I got from my own colleagues. So I think we should believe in a principle that you should not grow, you should let everybody grow, and you should make an effort that you create a student population which will be of tremendous use. So this deep involvement of desire to let the enlightened orthopedic fraternity be created, that's, I would say, was my mission. And in that mission, I think wherever there was an opportunity, and you remember that even when it came to joint replacement, we got to the Ranawat. I said, we have got to go to all the places, and you not believe, once I took Dr. Ranawat to Miraj. So I used to feel that, and remember also to cater for the poor and the orthopedic surgeons from the villages and districts. I conducted workshop with Dr. B.B. Joshi in 80 centers in India, from Srinagar to Trivandrum and from Jamnagar to Shillong. And I think everywhere I come, I learn.
Can I ask you here, sir, for a young orthopedic surgeon who is, let's say, still younger than me, should he follow the academic way? Should he follow teaching way, what is your message to these youngsters who are still, kind of trying to climb up the ladder?
You have used the right word, time. Learn to manage your time. And you should have 5 qualities: focused behavior, dedication, determination. You must be very hardworking. And second thing is documentation.
Yeah. So
And second thing you must, yes, go ahead.
from all your point, I also remember Dr. Tanna sir telling me once that he also has a habit of listening to all his OT staff. And he, Tanna sir, please unmute yourself because I'm just going to pitch any one of you when I'm talking. So Tanna sir, I remember you also listened to your ward boy and his suggestion when your patient is on table. And you would listen to him very carefully to his suggestions and respect the suggestions.
But I feel intelligence is not education. Intelligence is an inborn situation. In an operation theater, so many times my theater nurse has bailed me out, saying that, sir, there is a fracture lower down. She tells me very, very politely without other assistant knowing it. And then I realize that I have missed that fracture. So I think if you are strict and you don't allow anybody to talk, then it becomes damn difficult. You are all by yourself. Here, if you allow everybody to talk and suggest, then I feel that you get the benefit of so many minds.
Yeah, that's, I think, a very good message, because a lot of time we young orthopedic surgeons tend to think that we are Superman once we are in the theater and we don't listen to anyone. And those suggestions, I think, even by the ward boy who is putting the patient on traction table, are so vital in looking at that missed fracture neck of femur when we are treating and passing a nail in the shark femur. Sorry, Tanna sir?
We all
Yeah.
are egoistic rascals. We do not accept other people knows. We only knows everything. That is how we have become big. And this is the reason why probably we don't listen to other people.
Yes. So this next 1 hour is dedicated to all you icons to really express and suggest the entire nation of orthopedic surgeons, young people, what we should be doing socially, academically, non-socially, non-orthopedically, and we are going to extract it out. Lard sir, back to you. Share your screen and show us the case.
Yes. Before that, you asked a good question.
Yes, sir.
As a doctor, I always felt that Mahatma Gandhi said, like a monkey, is listen no evil, talk no evil, see no evil. You should do other way around. Listen to everybody, talk later, and even look. So unless you look.
Sir, unmute please. Unmute please.
Okay.
Yeah. So you got 3 minutes to finish the case.
Okay.
We will not interact, we will not ask questions, just go.
Okay. This was a 30-year-old captain of a ship who fell from his ship in America, and he came to me after 4 weeks of injury in this status. Now, you see, this was his fracture. And they said that we have got to operate on you immediately. Otherwise, he was saying that let me go back to my home. I will manage it. They said, no, you got to do that here. So this is what which was to be attempted for this. And as usual, using a modern technology without facilities, the nail got stuck. So he had to do an osteotomy and had a part fracture into 6-7 part fracture. Put an axle fixator. So the captain said that I can travel like this. So they put him in a U-slab and send it to me like this. So my dilemma was there is multifibrin fracture, there is tremendous soft tissue disruption, there is disruption to the vascularity. Fortunately, there is no neurovascular injury, but multifragments and frank atrophic gap non-union. So I said, let me put a span in it. That time, you had the famous locking plate had come. You thought that all problems can be solved. So naturally, I put in a plate with an idea. I did not do first day bone grafting because I said to fix this, it took me about 2.5, 3 hours to put everything together. So I told him that you might require a bone grafting, but you also require a brace. So August he came after about 2 months, and I said, I don't like it, so you better put a graft. So I put a graft and used 2 screws and gave him brace support. He came back in November and asked me, doctor, I'm fine, I want to go on the ship. To be frank, I did not like that small gap on the medial side. And I said that I'm a little worried about it. He said, doctor, don't worry, I'm fine, I'm swimming, I'm doing everything, I'm lifting weight. So I was careful and I was really concerned. So one day while swimming on the ship, he fell and he broke. At this time, he was somewhere near Australia. So he phoned me from there and he said, no, doctor, now I want to come back to India. So he came to India and I had a big problem to remove all this plate, taking care of nerves and everything. So naturally, I took out and did a refixation with a block bone graft. Opened it, put a corticocancellar graft and fixed that graft with a plate. Now see what happened in about 4 weeks, 3.5 weeks. I could see a gap, so I thought whether it's getting infection. So I worked it up for infection, and I said, I'm really worried about it. He said, no, doctor, I have no fever, I have no problem, or parameters are normal, I'm using a brace. And he just went, I'm going on the ship because I cannot miss my ship. Now listen what was happening there. You could see a little bend there in September. This time I insisted that no, you should not leave it like this and we got to do something. But I'm sorry, I'll have to again do refixation and put bone graft. So this time when I did it, I could feel that go ahead. This is what happened. The graft got absorbed. And that space between the plate and the bone, I was always worried. And this time there was a breakage of screws. Now I had a big problem, no medullary cavity, gap non-union, atrophic now. So what do I do next? So I said that now to get proper fixation, I ruled out completely infection. And after having ruled out infection, I re-explored him. And this time, I put a lot of bone grafts and changed the position of the plate. And had that graft placed in, packed in nicely. And this time, I gave him a brace which was extended beyond elbow. Didn't allow him to do movement of the elbow, but allowed some movement of the shoulder. Now, this time, when I did this, I was pretty sure that I will be in a position to heal this. And you could see some amount of bone graft there. Here, if you could see, which I had put. See here, everything was packed. All over I was packed with the bone graft. So, after 2 years, I have a situation when it is completely healed. He had a full function. And this is how Neha, but I will run this video. I'll show you his function. 2.5 years and 5 surgeries. Normally, the patient leaves you, goes to somebody else, but I must say that he continued, and he continued because my talking to him, explaining to him that these are the problems associated. Right from the first day, my issue was we are dealing with a avascularized bone, which is going to take a long time to revascularize. Also, the muscles which are wasted, and you cannot just do internal fixation. You have to do augmentation. In augmentation, you have to do bracing. You have to have very careful and look at the result he has ended up. So I think these kind of cases, my message to this is a simple looking fracture which might have been treated even non-operatively or by proper pre-operative planning, you could have avoided all this. So for my young friends, new technology, new thing, don't just start, analyze it well, have a look at the fracture, see the diameter, whether your nail will fit in, do a pre-operative planning and choose a method which you think will do him good, will do no harm. So I thought this was case which had many challenges, destructed soft tissues, badly handled, multiple injuries, osteotomies, avascular bone. Luckily, he had not any neurovascular deficit. I thank you for
Very
your
good.
attention.
Very good. Thank you very much. There are no questions on this as yet, but I have a question, sir, for you.
Yes.
Today, we believe that, of course, we have to lage raho on many of such situations which are especially non-union numerous, and me and DDT sir have discussed this time and again. Now we know that of course we have to play with the technology very carefully, and we have to have patience, and we have to respect the biology, and we have to have an absolute rigidity in most of the situations in non-union. But biology preservation and adding biology at the non-union society is important. So thank you very much, Lard sir. It was great to have you. But for people who probably have always underestimated the power of contact, is your power of being in touch and influence BB Joshi sir, influence Chit Ranawat sir to bring to peripheral orthopedic surgeons their technology, and your contribution to Shushrusha Trust Hospital is absolutely mind-boggling. For junior orthopedic surgeons, young orthopedic surgeons who do not know this, Dr. Lard sir is heading Shushrusha Trust Hospital, which caters to many thousands people of Bombay, Dadar area, and he has been instrumental in reviving this to a great extent. And of course, who doesn't know your power of bringing Chit Ranawat to Mumbai, and our earlier Prime Minister from Delhi to Mumbai to get operated and get his knee replacement done. So with this,
Shishir,
yes,
I just want to make a comment for the young friends.
yes,
4 things I learned. You must have good operating environment, good training, good facilities, and if you don't have, don't treat. You can't treat this non-operatively because you still get a good union. If you are trained well, if you want to do surgery, it's not the implant. It's a surgeon who is important. And on table, you should ensure that there is a perfect reduction, bone-to-bone contact, and your implant holds this, and your stability is on the table. So if you are doubtful, don't give plaster. Don't try to say. So I think the message is take care of the soft tissues, handling of soft tissues, proper reduction techniques, adequate and stable fixation, ensured on the table, and studied post-operative care. And never tell a patient that I'll do this operation, you will be 100% normal.
yes, sir. Thank you,
Never
sir.
say that.
Thank you very much. We are moving on to Dr. Tanna sir. Tanna sir, it's just you and me now for some time. And I can see you sitting in Santorini. And if I may ask you, if you have to choose, I know the answer, but for the audience benefit, if you have to choose something not orthopedics, what do you think you would have become, sir? Unmute, please, unmute.
I think I have become a travel expert.
Why, sir?
Because I enjoy traveling. I've gone around almost all over the world, in travel.
So is that what makes you feel good about traveling? Is it looking at other places, experiencing people, talking to various people? What makes you happy traveling?
When I'm traveling, I get rid of you.
And
in the academics and everywhere, I think it is you completely forget the whole world, whatever is there around. You only You only are there with yourself and whatever your friends, your father and J.S. Kulkarni, I think we have shared these travels all the time.
Yeah. Funnily enough, I am watching this very, very famous Netflix serial called as Breaking Bad. In this, this professor of chemistry is completely doing during daytime his job which he's meant to do, and in the night to earn more, what he is doing is making drugs in its purest form. So because he is a chemist, he can look in the manufacturing of drug in a very, very different perspective, and he applies his chemistry to manufacturing of drug. This series is supposed to be the most famous series in the world today, Breaking Bad, and I recommend all of you to watch it.
I would add a little what you mentioned.
Yes.
I'm very fond of bridge, which is a highly intellectual game, and a chess. And this analysis of chess and bridge, it helps you quite a lot in orthopedics to analyze those problems, cool down, and solve the issue.
Absolutely.
And I feel it is a parallel things. It works.
Yeah. So I was coming to that. What makes you think your traveling, your bridge, and your golf improves your orthopedics part of it?
I think orthopedic is one part of life. It's not life. To me, orthopedic is not life. Orthopedic is one part of life which I have lived, and you know it very well. I think I do almost 1,000 things myself. I enjoy that. I have a small slides which, if you like, I can show that.
Absolutely. Go ahead. Share your screen.
This is my mentor. This is Dr. Chaubal, and probably I have learned a lot from him, orthopedics and non-orthopedics.
So can I stop you there? Can I stop you there for a while, sir?
Yes, please.
I know Dr. K.V. Chaubal and your story because Dr. K.V. Chaubal has been my father's guide as well. And if we go back a couple of years ago, I always remember you fondly telling me the story which made you an absolute superhero those days in the orthopedic world, that generation. Because Dr. Chaubal came to you and he asked you to perform surgery on him. And you fondly cherished that entire event, that thought process. Can you just elaborate on that, please?
Dr. Chaubal he is my boss, he is my mentor. I was 39-year-old, he was 49, he was the famous orthopedic surgeon there. And he had a problem in his spine and he needed operations. We went around, did all the investigations, and I was there like a ward boy moving around with him and doing everything, whatever he needed to be done. And one fine day, he calls us at home and he tells me, Tanna, arrange everything in Bhatia Hospital, you going to operate. And to me, as you can understand, at the age of 39, my own boss, famous person, asking me to operate, I don't think ever I have done any bigger operation than Dr. Chaubal. And I think after a few years, I asked him, after a few months or years, sir, why did you choose me to operate on you when there were so many other people there? And the answer which he gave me, which is, I won't talk here, but I think it is the one which is most satisfactory to me in my existence.
Yeah. Wow. Terrific, sir. And I'm sure that gave you a great boost psychologically, mentally, and of course, socially and in the orthopedic academic world. Yes.
I think when you talk about an incident, let me tell you, if you don't mind.
Sure.
तुमने भी प्यार किया ना
सर.
प्यार कोई कर नहीं सकता, प्यार हो ही जाता है. The icons, you don't become icons. You don't try to become icons. I think over your work, as the years roll by and all, other people tell you icons. I think icon is, if you see the definition of an icon is where other people perceive you as something better than the rest of them, and they call you icon. So it is an imaginary of the other people who are working around you and they call you icon.
Absolutely.
Nobody tries to be icon. You
Absolutely.
just become icon.
Absolutely, absolutely. So here is the day for all of you to guide us, the orthopedic surgeons who have followed you like Dronacharya, Eklavya relationship, to tell us how we should behave. We know how to plate a humerus, we know how to nail a tibia, we know how to fix a hip fracture. We want to listen from you today what we should do to raise our standards very high in the eyes of teacher, to raise our standards very high academically, to spread in the society what Lard sir had spread through Bibi Joshi and Chitra Nawat. So this is what we want to hear. Tanna sir, over to you. Please show us the slides, what you want to show us.
This is in जवानी में भी अभी कुछ वैसे वैसे थे, ऐसे कुछ सीधे साधे नहीं थे. This is what has been teaching somewhere in India has been my passion. Somehow I have been doing it again and again all over, stupidly going from one corner to other corner. I don't know why. This is in TraumaCon, 1,500 to 1,800 people. It's a treat to really teach in TraumaCon. These are the books I have written. And these are the three people with whom I have spent a lot of my life. This is Dr. Kulkarni, Dr. Babulkar, and Dr. Tanna. And this is where we traveled around at minus 22 in Arctic. These are 6 of us have seen the world like nobody's business. I think we have to now find a place where we can go. This is my family, which I am very attached to the family. And this is, we travel with my family once a year somewhere in the world. And we go around. This is somewhere in Hawaii, I think. And all of us enjoy that and we wait for that day. This is with my children and with my all grandchildren. Life is not about waiting for the storm to pass. It is about learning to dance in the rain. And this is what I believe. And that and this is with Govind, Amit. I think we have been dancing around all the time. There is only one success to be able to spend your life your own way. Don't try to talk it the way other people want to live. This is the only way you can live. You know it very well. I think how the life goes. I am very fond of golf. I'm very fond of golf. I spend my weekends on golf. And bridge, I think it is a passion. In this breakdown, 2-3 hours of bridge, and I have elevated my level of bridge. I am extremely, I feel this is the one which is really sharpens you, keeps you alive, keeps you young, and it keeps you experiencing all sorts of things. This is about 4 years back at the age of 78, and this is scuba diving. I must have done 25-30 scuba dives in the time. This was one thing which was remaining, which I could do it very late, about 2 years back. I could do this paragliding, parasailing, and this is our exotic vacations. This is in Antarctica. This is with D.S. Kulkarni, Babulkar, all 6 of us family. This is one of our dream vacations, what we have done. And this is the Arctic voyage. This is Aurora Borealis. And this is somewhere in Iceland. So I feel life, orthopedic is one of the major part of our life. But apart from orthopedics, there is a lot of things which is there in the life which you and me can really live it. This is how I feel about it. I do not know what other people feel, but orthopedically I feel the only thing what you need is the passion. If you have the passion, then you can live the life. If you can do 1,000 things, then you are capable of doing 1,000 things. I always get surprised why people say that how do we find time for this? Saying there is lots of time available to each one of us. Somehow, I do not know, I can find time at the cost of other things probably.
So actually you ended up answering a lot of questions, Tanna sir, because there were a lot of questions saying that I have such a huge practice, and I'm so pushed by my patients. How do you find time for golf and bridge?
Compartment. It is a life is a compartment. You can't leave everything. Only orthopedics, I think I'll be miserable if I did only orthopedics. When you're doing orthopedics, passionately you do orthopedics. When you're playing golf, passionately you play golf. You're playing bridge, you passionately play, you travel. I think there is time for everything. But what happens is we get all bogged down by our own thought process.
And I think I will add to your own answer, because that's my observation about you, is perfection. Because if you won't reduce your fracture neck of femur in a closed way, you would open it up,
Absolutely.
and that has increased the incidence of opening it up and fixing it to achieve that absolute anatomical reduction has increased, right?
I'll describe one thing. I went for a round, and in the morning, 8 o'clock, the boys showed me an excellent operated case. And then he tells me, sir, this is what was originally done. It was a very bad reduction. And since today was the round, sir, at 2 o'clock at night, we took the patient away, and we wanted to show you this good X-ray to be operated upon. And that goes into the juniors also, that whatever you do has to be done perfect. You can't do any half-hazard things.
So can I ask you a practical question, which a lot of junior orthopedic surgeons who have just entered practice in, let's say, within 5 years of their practice, and if they see not so good article reduction of, let's say, proximal tibia, how do you convince your patient that you have to go back again and reduce that anatomically, or reduce that DHS again and put a...
Don't leave the patient. Don't leave the patient on the table. Do whatever it is. If it needs time, it needs time. I feel that I have no watch in my operation theatre, and nobody is allowed to tell me that, sir, itna bach gaya. You have another thing.
But let's say the patient is out of operation theatre, and second day you realize that the job you have done and probably image intensifier did not show you properly fracture neck of femur reduction.
Yeah, I think I am very, very, very open to the patient. I tell him, sorry, something has gone wrong, and I feel that I need to repair it. And if you trust me, I'll repair it. And 99% of the time, patient doesn't deny.
Okay, thank you very much, Dr. Danna sir. It was great listening to you. And for the audience benefit, I know how perfectionist he is. He missed that camera shot of parasailing. He took all of us back again to do parasailing once again to have the proper shot of he and parasailing. So it can be a torture.
Thank you.
Let's move on to the next icon. Dr. Danna sir, don't go away. There is a surprise fire at you. Dr. G.S. Kulkarni sir, coming back to you. So it's been great getting associated with G.S. Kulkarni sir, and we have been together since many years, and I have been associated more with him because I had that special liking which he grew in me along with my father, of being able to write articles, write books, and he has been great enthusiast in imbibing that idea in me that Sushruth, you have to do this. Sushruth, every time he will meet me, Sushruth, come. Sushruth, you have to make sure that we come out with a journal. And every time I have a hard time dodging him, sir. That's not viable. And we still keep on fighting on fracture neck of femur issues. And we talk almost 3 or 4 times in a week on fracture neck of femur these days. Sir, over to you. What do you want to show us? Your iconic case.
Yeah, you want me to see the case first, or I'd like me to talk about how things happen.
Absolutely, please.
Yeah, how things happen in my life. How many people had contributed. Last page. Short. Hey. Just a minute, Sushruth.
Oh, sir.
What's I want to tell you the turning points in my life. I met Augusto Sarmiento in 1979 in one of the academy meet that time, and we became great friends. And one day he told me, GS, your country is a large country with such large clinical material. Why don't you do some research work on non-operative treatment and operative treatment? So I took up his challenge and he said, you start first on rabbits and then do on human beings in your patients. So I did that, and to my surprise, it was a great work. So I submitted to ICMR in 1982, and the ICMR sanctioned 1 crore rupees at that time. So from that lot of money, maybe 10 crores today or more, in 1982, I got the image intensifier, laminar airflow in 1983, and expanded my hospital. With the help of my academic interest and infrastructure, my hospital got recognized MS Orthopedics, and in 1989, I met Pele, and I was as you know, I was interested in academically. So I talked to him and he said, you come to my hospital for 10 days or 12 days. So immediately I went to him. He, fortunately, I stayed with him. He said, you stay with me, don't stay in the hospital. I will take you at 6 o'clock in the morning. We used to go at 6 o'clock in the morning and come back at 10 o'clock at night. So whole day he was teaching me. For 10 days he taught me. Not only that, while coming back, he gave me all the equipments, from the rings, and because they don't use second time, it is waste to them. So you take them away. So when I brought them all the equipment and gave it to Pitkar Senior, and he produced all this. So I started doing Ilidharo in 1989, and there was Chennai conference, and I met Ilidharo. Myself, a Hardikar were in one room, and next room was Ilidharo. I was the faculty at the Chennai conference in 1991 with Ilidharo himself. Ilidharo is a very funny person. You know, though he is very intelligent and hardworking, he had some negative. He created a lot of problems in Chennai. Anyway, I will not go into that. But his one habit is he's a chain smoker. Even during surgery, the sister used to take out his mask and put a lighted cigarette in his mouth, and he used to have some puffs and then again start surgery. So that ultimately the smoking killed him. So from there I went to all states of India to teach Ilidharo. Of course, now Ilidharo has come down to definite indications. In 1977, I had been to Italy for a tour, and there on the same town, J. Krishnamurti was talking, and he was talking on mutation of mind. And I was really very much interested, and he introduced me to spiritual aspect of life. So, and as soon as I came back, I started reading on spiritual aspects, and I found that every orthopedic surgeon must have good health to improve. If you have a good health, then that will improve your orthopedics also. That was I learned. And then I started reading on the science of nutrition and scientific exercises. And for the last 35 years or more, I am going to gym every day without fail, and I take balanced diet. Then as Dr. Tanna and Babulkar, we go on every year, twice a year on nature. Wherever there is a good natural spots, we go there and we enjoy the nature like anything. It's also a sort of meditation. Enjoying the nature is a meditation. So when they are eating garam patata vada and kachori and other things, I really was tempted, but I controlled myself because I am on balance. So since then, I am doing a lot of work on gym and balanced diet. This has given me good health, very good health. And So that so much so that I never get any even sore throat. I have never in last 30, 40 years, I have never missed my hospital because of some ill health, fever, this, that. Only I had, of course, one joint replacement. Then I went to Igatpuri for Vipassana and Sudarshan Kriya for Sri Sri Ravi Shankar and Rajneesh Pune and many other places. But I had all the while, is it scientifically proved? Is it okay what these big gurus are telling? So I started doing a scientific work and meditation and spirituality. So in that I was very much, I started exploring. And then I got 3 books of scientific work. One is the Elizabeth Blackburn, Telomere Effect on Health, Happiness and Longevity. For her, this work, she got Nobel Prize in 2009. And in 2017, she wrote a book on what is called a telomere effect on health, happiness, and longevity. This book you must read, Sushrut. Yeah. This book is a very good book. The second book I came across was Autophagy by Yoshinori Kosumi, a Japanese microbiologist, molecular biologist, and he got the Nobel Prize in 2016 for his work on autophagy. And since then I am practicing autophagy. Autophagy means, you have to 16 hours starving and 8 hours eating. And also, turmeric, halad, simple halad, take half teaspoonful of halad every day and your health is tremendously improves. Your immunity improves and the autophagy improves. You must go into net for autophagy details because in a short time I can't tell you that. In my own case, I have diabetes because it is a gift from my father. All of my sisters and brothers, all are diabetic. Our family is called a sweet family. But autophagy, I was taking 4 tablets for diabetes, but now it has come down to 1 tablet because of autophagy. And the third one is recently, I got a book called Tanya Singer's book, Compassion, Science and Practice. The Tanya Singer is a neuroscientist from Germany, and she was the head of the department in Zurich of the neuroscience, and she was trained in London neuroscience, School of Neuroscience. So these 3 books have changed my life. So I very, very strongly suggest that you should read these 3 books. My younger listeners, I would suggest that they should read 3 books that will change your lifestyle. So I was called for a big conference about 4 or 5 years back to talk on health, happiness and longevity. Since then, I have talked on many times, and last time Rajesh P. Gadigad organized a webinar on health, happiness and longevity. So I attended that. She said that 10,000 people attended. Last week, Medical Students Association called me for this. Somebody talked to me and said. So my advice to all of you and also the listeners that you should not only do, as Tanna said, not only do orthopedic. Orthopedic is really a very part of your business. It just should be 6 to 8 hours should be orthopedics. 8 hours should be for yourself and 8 hours should be for the family. So like that you should divide. And I think orthopedic should be, of course, is a concentration and focusing and learning is all that there. But the spirituality, science of spirituality, I am talking science of spirituality should be imbibed in you so that you will not only be happy in life, but your orthopedic practice also increases efficiency.
So thank you. So the question which will come to a young orthopedic surgeon's mind is, sir, आप अभी 70-80 plus हो गए, अब ये जाके spirituality की बात कर रहे हो, मैं तो अभी 35 years का हूँ. On top of my
very good question, Sushrut. The spirituality.
I was going to ask it. I was going to ask him, you are 87. अभी हमारे I am 82. तो हमको क्यों बोल रहे हैं?
Now there is a saying in Marathi. करून करून भागले आणि काशी यात्रेला गेले. म्हणजे you did everything in life and then went to Kashi Yatra. No, not like that. See, I started. As I told you, this was my maternal uncle is a sannyasi, and he was all the while talking to me since my childhood that you should behave like this, you should do like this, you should do meditation, you should do. So, but I was not doing as much as in my younger age. But at the age of 35, 40, I started spirituality, and then I went on to do the spirituality. So, spirituality should be there in your curriculum, in your daily activity. There should be at least 1 or 2 hours of reading, meditation, and do some workshop like that. Yes, Sushrut?
Thank you very much, sir, for igniting our minds. Do you want to show the case, sir?
Yeah, I will show you.
Yes.
Case.
Cancel Guru.
Case. Agash's case. Short. I'm sure this is a very interesting case. A 14-year-old boy had funny symptoms. He was a good student at class, but slowly he started taking lack of interest. And he was not attending school, not attentive and all that. He had loss of appetite and also started losing weight and started getting knock knee, started limping with funny gait. That's what the father told me. This lasted for 2 years. He was taking, he went to many specialists, but nobody could operate on him, but he was only doing surgery. See, this is how he came to me with a very severe knock knee, as you can see here. And on examination, he was a weak body, waddling gait and knock knees, restricted internal rotation and abduction. Other movements were normal. Intermalleolar distance was 40 centimeters. So this is, as you know, this is can be easily said that this is scaphy, and you can see the varus deformity. The neck shaft angle is less than 90, around 80 or 85. So severe was the varus deformity at the hip and valgus deformity at the knee. These are two opposite things. At one at hip and other was thing. This was a big problem for most of the orthopedic surgeons. This was in around 1998 or so, about 20 years back. Severe varus and valgus. So we started investigating what is the cause of this. As you know, scaphy may be secondary to endocrine problem. So we started from doing endocrinological, all the investigations. And he has this, you can see this knee joint is very severely valgus and also squinting patella because of the severe valgus deformity. He consulted many specialists. Nobody was ready to do surgery on him. All medical treatment was given to him for 3 years. So let us go further. So investigations, endocrinological tests were then, calcium was 11, parathermone was very high. So the diagnosis was hyperparathyroidism. So this was confirmed by ultrasonography, and the nodule was excised. Then this we started pinning that time. This was the popular method and it worked very well. Still today I do this, but it is. But there are many other methods of now scaphy treatment. Let's not go. So this is how we did this, and then Ilizaro came to my help because you can manage. The great advantage of Ilizaro in this case is you can correct the varus deformity at hip and valgus deformity at. If you try to do with plating and this, then it will be, once you do it, then it becomes very difficult to such a severe deformities at both hip and knee to do with plating would have been very difficult. So I can adjust my rings so that I can correct the deformity, and what is the most important is the mechanical axis. the mechanical axis must be corrected. So we started doing this, and so that we can went on readjusting till we get the perfect mechanical axis up during the post-operative period. Before, after 1 month, we used to do some corrections. So that is the advantage. See, the mechanical axis is normal. So these are some of the post-operative X-rays, both osteotomy done at the knee as well as at the hip. And 1 year after, this is 1 year after. This is 3 years after. This is 3 years after, and this is the final. He is perfectly, absolutely run right now. His psychology also is improved. His health has improved, and he is back to work. Thank you.
Terrific, sir. Thank you very much. Great case. Thinking of newer technology always has supported your climb up the ladder and reaching the stage of icon as you are today. Let's move on to the next iconic figure whom I have really respected huge, not only because he is father of a close friend of mine, but also the one who migrated from Mumbai as a contemporary of my father, went to Pune and constructed this huge place which is called as Sancheti Hospital today, and became an icon not only in the country but abroad. And that's presenting to you K. Sancheti sir. Sir, do you want to say a few words? What helped you in becoming a big time superhero and icon in orthopedics today? Sir, unmute kara tumhala.
Yes. So thank you very much for your very nice introduction, very affectionate, personal, and that's how all three of you, your friends, have grown and you are growing. That's what I was also doing right from the beginning. When I did my MBBS from Pune, I got admissions for MS Orthopedics in Bombay, and since I was from Pune, not from Bombay, I used to get a little second-class kind of treatment, and my knowledge was also not very good. Even once Dr. Tarwekar told me, if your performance do not improve, I will throw you out of the window. That was the situation of my academic and orthopedic knowledge. But what I was very much interested in is patient's care. Looking after the patient, writing the notes of Dr. A.K. Tarwekar in his green book, and learning something new and new all the time. So while doing that, I developed a habit that do something new, do something different. After passing my MS Orthopedics, I did MS Orthopedics in 1965 in say September, and in December 1965, 12 December, I started my practice in late Dr. Motwani's nursing home as a rented place in Pune. But that was not sufficient. That was not only my ball game. All the time, I was feeling that I must increase, I must expand.
Can I add something on this?
Yes.
Kanti purchased the nursing home, Motwani nursing home, even before he was MS.
Yes.
He paid money for that. And yes. I remember all of us went for that opening ceremony after. I said, Kanti, pass होएगा ऐसा कोई जरूरी है क्या? नहीं, pass तो होएगा ना कभी.
अरे वाह. I still remember, believe that very much. You know, risk taking ability. What is entrepreneurship? Entrepreneurship means ability to take risk. In life, I always like to take risk. I took the risk of renting a nursing home before passing MS. Then I started practice. Then practice grew, and again something new I want to do. So I did. Then made a trust, made a hospital, and that was not enough. This my ability to grow and grow like nature. Nature likes to grow all the time. I had that similar kind of instinct in me. So in what happened in 1973, long back, 73 means now how many years? 30, 40 years before. I went to the Dean Vijay Medical College, to the Vice Chancellor of Pune University, and my private nursing home, I got it recognized for MS Orthopedics. You know, that time I was the first in India to think of that. So thinking out of the box, what I want to say, thinking different to make this. Now I made a hospital. What is my thinking different? I will go out of the four corners, four walls of the hospital, conduct camps all over Maharashtra, conduct camps in the Karnataka, MP, etc. And I collected a lot of data, helped a lot of polio patients. In my early days of practice, there was tremendous polio affection and a lot of polio patients I used to get, and a lot of residual cases were all there also. So I did collected data, kept this everything and prepared a guidelines, and luckily in 1991, government recognized that and gave me Padma Shri of 1991. So again, I was happy, contented, but always I wanted to grow. So then out of the data, I prepared guidelines and worked, found out the different various operations which can be done on the polio, etc. And in 2003, I got Padma Bhushan award from President of India. By that time, the polio got over. And though I switched from pediatrics to geriatrics. And in geriatrics, problem of old people, as you know, in India, arthritis of the knee, then other things, I worked on that. I started again, same concept of conducting camps and going to different places on that. And then I found when we advised the knee replacement operation, out of 10, only 3 could get it, and others could not get it because of the financial aspect. So I decided to design an indigenous knee. You will be surprised when I decided to do an indigenous knee, and there was, I went to different industrialists in Pune workshops, but they were not ready to give me 10, 15 pieces of knee. So what I did, in the basement of the hospital, Tanna, Dilip, you must have seen that also. I purchased all the equipment, 3-axis CNC, 5-axis CNC, grinding machine, drilling machine, and manufactured first indigenous knee in the basement of my hospital. You know, what I want to say, doing something different and not getting stopped. Oh, मेरे को कोई नहीं दे रहा, तो मैं करूँगा, मैं खुद ले लूँगा. What does it matter? That kind of approach has made me different than others and to make me is. In fact, I did the first out of this indigenous knee. I want to show you one case. Shall I show
Yes, sir. Please share the slide.
Yes, I'll tell you.
Unfortunately, we are lagging behind the time. So 3 minutes, please. Each one.
Yes, I'll finish it very fast.
Yes, thank you.
Yeah, this is the patient where the indigenous knee manufactured in the basement of my hospital was fitted to this case. So this is a 65-year-old female, had a pain and deformity for years together, difficulty in walking, only household ambulatory and severe varus and valgus severe deformity you can see. See, this is the clinical photograph, and see the x-rays of the standing x-ray, weight-bearing x-ray of that patient. This is the right AP lateral, and you can show that. Here is the stress fracture. Show this also. Yes. Now this was the case. Next, yeah. And then there was a large bone defect. So we could not afford very expensive equipment or a revision knee equipment. So what I did, I always used to find something different. So this was a bone loss in the tibia. Then what I did, mine is the cantilever bone grafting. So I created a slot there, and next a slot there, and this was the tibial graft. From there, a slot was fitted in, and excess bone was removed and made a platform for the tibia to this. Next, then here this is the slot in the medial side. You can see this is the slot. Next, and here is the bone graft prepared out of the tibia, and this bone graft will go inside this. Next, go inside this, and you see here this bone graft is fitted in that slot. This here I put a screw from the medial side, and next and then the excess bone was removed. Now here is that particular AP X-ray, immediate post-operative X-ray. He had a pseudo fractures also. You can see these pseudo fractures and fixation of additional by screws, etc. What I mean to say, I will do something. I did this industry for such a severe deformity, and this is the post-operative X-ray, and this is the after 6 months or 1 year. This was the way she was walking, and next, this is the X-ray after 5 years. Even though it is well maintained, 5 years well maintained, and she is doing quite all right. What I want to say, I would do something different and see that it happens. That made me to grow in hospital. Only one last point I will say, and then I'll stop it. Yes, you know, people tell me, Dr. Sancheti, you have got Duradrushti long, and because of long vision, you are able to do so. I said, no. I give one example that Senapati Bapat, when went to Bal Gandharva Tilak, and they want to take part in the Goa Morcha and etc. So Tilak told him, you are an old man of 80, you cannot see beyond 20 feet, and how can you do it? So what Senapati Bapat answered is worth remembering. He said to Tatya, I agree that I cannot see beyond 20 units, but when I go to 20 units, I can see further 20 feet. I cannot see more than 20 feet, but when I go to 20 feet, I can see further 20 feet. That has been my approach. I'll get something, I'll get new, and that's how I go on. Thank you very much for giving me patient hearing. And
thank you very much. Thank you very much.
Sushrut, if I can add up.
Absolutely, sir.
Me and Kanti passed our MS together. We started our career together. But see over the years where he has reached and where I have remained. This is what is the Kanti's greatness.
No. No, you have got different habits. You are a big man, Dilip. You are a very big man.
He is different.
Shishru,
Yeah.
this madman is also obsessed with the upper femoral prosthesis. And he would make wood models and come to my office and tell me, and every time he came, he had a new design. So he goes on designing everything. So, and you know, he's a great architect.
Yeah.
He is a great architect. He's a designer. So, you know, one of the municipal hospitals, government hospitals, designed by him. So he is a real structural person.
Absolutely.
Thank you.
There is no doubt that he is an icon and he is great, and we absolutely follow and love you, Kanti sir. Let's move on to the next icon, and the next icon is from the same city, and he is again father of a dear friend of mine, Dr. Madan Hardikar, and we have to us Dr. S.M. Hardikar sir. Sir, tell us the story. What you think in your eyes made you a Superman what you are today, Hardikar sir, and then we will have a quick 3-minute case from you.
Hello. Can you hear me?
Yes, sir.
Just to tell my story short, because a lot of people have said lots of things, etc. After passing my MBBS, I went to a mission hospital in Jalna where I had profound experience in all branches. I think I must have done about 100 operations in 1 year's time. And my boss was a Scottish gentleman, Dr. William Todd. From there I moved on to Vellore, where Dr. Paul Brand, whom I used to assist for his surgery, made a tremendous impression, and his hand surgery in leprosy people, his operation is very famously known as many-tailed operation. So he also made big impression on me, and from Vellore, I went to Britain and thereafter East Africa. My chief, Professor Huckstep, who was in charge of the biggest polio center in African continent, and I had a great opportunity to learn under him, and thereafter I decided to come back for good and start my practice. So some of these people who made a lot of impression on the subject wise or the clinical side, But at the same time, there are many people who entered my life and they taught me and they impressed me in many ways. I'll give one example of Osho. I had the opportunity of treating him right from the beginning to the end till he was really almost on the deathbed. So I was really impressed with the kind of a person and the way he could create so much. So these are the various occasions which made me think about many things. Dr. J.S. Kulkarni mentioned about the nature. I'm a great believer in nature because nature is your best teacher. So orthopedic is only a small part of our life, and there are far more things, many things to learn from various big shots or the icons, and from there you can decide your own way of ultimately you read the books, you follow people, but ultimately you have to decide which is best suited for your personality and how are you going to change yourself to suit that. So this is how it went on, and today at the end of about my I returned in 1967. Since then I'm in my practice. We have got our Hardikar Hospital. And then I got great pleasure when we started treating the children of spasticity. So we opened a clinic for the spastic children, and we had actually gate lab in which we used to see the recording, the way they walk, and accordingly we used to plan the surgery. Dr. Prakash, who was my assistant and still is there, he learned a particular technique for surgery in Japan. He came and we used to operate free of charge many such spastic children. So that was another area. Polio was another area. Trauma is another area. And it goes on and on for the last now, since 67, more than 50 years I'm in practice. But your interest in the subject remains because you have to have interest to learn more and more without getting just stale. So these are the people who made a lot of impression on me, and I got inspired from them, and this is how I still go on. People ask me at the age of 88, how are you still working? But I say I don't feel my 88. I don't never consider, because my routine has not changed at all. It's just the same. I attend the conferences, participate in that, and it goes on. So maintaining the interest in your subject associated with reading, and I have written quite a few booklets on poliomyelitis, on arthritis, then on osteoporosis. Recent book. And recently, I have great pleasure that I wrote an operative orthopedic book along with my career colleagues, Dr. Shintre and Dr. Panchanadikar. So this is 800 pages book. First time in the world. This is what the publishers told me, because this contains only pictures right from trolley to sutures with very small comments on that. So this is a unique book, and I have a pleasure that the publishers themselves came to me and requested me whether I could do that. So that is one of the very fortunate things that came to my way without asking, without approaching anyone. And I was at Bombay Orthodox Society. And recently that book got the Year of the Book award recently in the Bombay Orthopedic Conference. So it is one of the best books, and I was lucky to have been the author of that.
Terrific, sir. We are very eager to hear from you the case that you want to show us, which became the landmark case, as you said. JSK sir,
I want to talk about Hardikar 1 minute.
Sure.
Hardikar is not only as a good orthopedic person, but he is a literary man. His Marathi literature is immense. He has written a lot of work, and he has and he is a big conversationalist. If you are in his company for 4 or 5, he will make the whole lively conversation. He's a very humorous person. He has a lot of jokes at his place, and he talks very nicely. This is very lively. He makes the whole company very lively. That's I found him. So we are a great friend since last so many years. And whenever I am in Pune, I always try to meet him.
I still remember. I still remember one story when Hadikar Kaka, we call him Hadikar Kaka, was in my house, and we were just married those days, me and Nandini, and in my house was Sugioka, Bakshi, Hadikar sir. Sir, do you remember that?
Yeah,
When,
I was there.
You were there, of course. Yes, you
Yeah,
were.
I was also there.
Yes, yes. And we had a small get together, and my wife, who
You
was.
didn't invite me, Shushrut.
The story sounds funny because if you would have been invited, that incident would have happened with you. So my wife was just new in the house, and it was her second day after my marriage, and my dad, my Baba, asked her to bring orange juice to serve everyone. It was hot, scorchy summer, and she brought the orange juice, and suddenly Sugioka and Hadikar sir were discussing, and they were at a heat of argument, and Hadikar sir was right in his argument, Sugioka was wrong, and Hadikar sir got up. My wife was holding the orange juice tray, and it all spilled over him. And you can imagine Hadikar sir with orange juice full of and trickling all over his face, and he did not bother about it. He said, "Don't worry, Nandini, माझं नागपुरी संत्र झालं." I became the Nagpur orange today. And he continued with the argument in the whole mood. So Dr. Sir, I am sure now you would have taken your sentence back. You didn't invite me. Sir, we are very
good you didn't invite me.
One thing I want to say is that it is the duty of every orthopedic surgeon.
Yes.
I'm just talking about the orthopedic surgeon.
Yeah.
To be able to see the other parts of Maharashtra and other parts of India. We did more than about 125 camps through them. We reached all parts of Maharashtra, and I was shocked in Dhulia district, in a very peripheral town close to Gujarat. I couldn't talk to them because their Iranian language, I didn't know anything about it. So in my own state, I'm not able to communicate with the people, and that's how, because there are so many dialects. So I think we must know our own state, our own people of different strata. And through the camp, we really got good darshan of India in nutshell. So I think there's no question of only just sticking on to your practice and going here and there. You have got to travel all over Maharashtra, even out of Maharashtra, to be able to know exact the way our people are, the way we people live, the way our thinking is, and this also helps in planning our, not only thinking, but also planning our treatment according to the geographical variation, according to the economical variation. All those factors must be taken. Textbooks are only guide, but thereafter, in a country like ours with all kinds of people, we must apply all that and create our own way of treating the patient.
Absolutely. Shall we move on to the case, please? Because we have very less time.
Yes, the case does. The case आमची. सुरू कर. तुम्ही बोला ना. This is one of the various interesting cases that I have. We have handled it, and with very good result indeed. So this is a very rare case of pelvic fracture. Next. 16-year-old female with a history of RT at Satara had sustained pelvic fracture with vaginal tear. Was immediately taken to local hospital. X-rays and 3D CT were done there, initial treatment like suturing of the vaginal wall, it was done, patient was stabilized and then shifted to our hospital. Next. Now, on examination, I found that 25 by 30 centimeter degloving wound over the right buttock, and the range of movement of the lower limb was very painful and sensations were also affected. PV examination sutured and the vaginal wall was noted. Police catheter was in situ. X-ray. This X-ray shows the fracture of the pelvis SI joint and SI joint fully displaced upwards. So there is as you can see, the whole pelvis, the whole thing has gone upstairs. Besides that, the patient also has got the fracture of the acetabulum. So sacroiliac dislocation and the fracture in this base of the acetabulum, these are the main thing, and the whole leg along with the pelvis was shifted superiorly. Next. Next. Now this is the 3D CT, and you can see the vertical shear and the you can see the transverse. That also you can see. The various images are there to tell you every detail about this fracture. Next. So we decided to operate and restore the normal anatomy, and we did the anterior approach, modified ilioinguinal incision so as to visualize sacroiliac joint, pubic symphysis. With the help of the surgeon, we fixed it up, and then we had the Langenbeck approach and the posterior approach. Next. Now this is the X-ray after our fixation. You can see here the fixation of the symphysis pubis. You can see the fixation of the sacroiliac joint, and also all these pelvic fractures being fixed with these plates and screws. And there was no post-operative complication except foot drop. Next. But over a period that also recovered to almost X-ray 2 months. This is X-ray of the same patient 2 months later. Next. One more view. Next. 6 months later. This is at the end of 6 months. And the latest X-ray shows like this. Fracture. Next. Fracture has healed. Next. And the sacroiliac is quite stable. Now, this is the healed wound. Originally, I had mentioned about this. What were the post-operative complications? Right-sided foot drop, as I said, because of that injury to the nerve. Area of 25 by 30 centimeter of degloved gluteal skin developed necrosis, partly skin grafted and partly sutured, failed. So serial dressing with a silver iconic solution done, 7 months post-op, wound healed. Next. Current status, 11 months post-op, power in the lower limb grade 4, foot drop grade 3, and lower limb range of movement is good. So a very complicated case, but at the same time it was a challenging case. Luckily we could manage to reasonably satisfactory status. Next. That's all.
Okay.
Now this is the patient, actually it's not very clearly seen, but she's the patient who is now walking comfortably with a little foot drop.
A great way to suggest, sir. Can we stop slide share, please? A great way to suggest that such a complicated case can also be very effectively managed by a good and proper intervention. Now, since we have done the first lot, which includes Lad sir, Tanna sir, Sancheti sir, Kulkarni sir, and Hardikar sir, who are from Mumbai and around Mumbai, Pune, and though as Sancheti said, I was from Pune, but I was still looked upon. My question to Tanna sir, we can't see you. Please make your video on, because this is a rapid fire question to all 5 of you. Kanna sir, are you there? Okay, so then now we can see you. So this is a rapid fire question to all 5 of you who have already presented your case. And we want just one-liner answer, wherein I am going to ask, Lad sir, one-liner answer, who was your superhero in your life? May it be an orthopedic person, may it be a non-orthopedic person, may it be someone from a social background who influenced you, from your relative. Who was your superhero? We want to know that.
Jai Prakash Narayan.
G.S. Kulkarni sir, your superhero.
सुपरहिरो कोण तुमचा सुपरहिरो ते विचारतील नाही तुमचं पॉलिटिकल लीडर किंवा हे RSS चे कोण होते
Muted.
Sir, you are muted. Unmute kara. G.S.
My superhero is my maternal uncle who made me what I am today.
Okay. So the one who you were talking about, who is Sanyashi?
Yeah, that's right.
Hardikar sir, who is your superhero?
Well, this is again a controversial, but the way I have really known, understood Osho, I would really consider him as a superhero for one reason. It's not just the outward look, but when I went to his room where hardly anybody is allowed, I just saw a one chair, heap of books and a blade on the floor. But this man's subjects of study were profound. And I have read a lot of books of Osho. And so he is the one I would consider as my superhero as of now.
So Madam, we were hearing you in the background. You also don't know your father's superhero because you are trying to prompt him, RSS man. He is not your father's superhero. Kanda sir.
Pandurang Athawale.
Pandurang
Athawale, he was a philosopher. He was a reformer in Maharashtra and all over India. He's the one who has impressed me the most.
All right. Sancheti sir, your superhero. Sir, unmute kara please. Unmute.
ऐकू आलं? Dr. E.H. Koyaji, who was only LCPS, but he was a general practitioner. I worked with him for 1 year and there I learned a lot. One give small example. Okay, I don't want to give much. Second, my hero is J.P. Vaswani, spiritual guru. These were 2 gurus because of which I have grown to this level.
My second question to all of you again, because you are based in and out of Bombay or near Bombay, if you ever had an opportunity to marry a Bollywood star of your Western era, who would that name be? Lad sir.
बॉलिवूड तुमच्या वेळचे बॉलिवूड हिरोईन्स मशी तुम्हाला आवडलं असतं लग्न करायला
मधुबाला हडीकर सर
नलिनी जयवंत
सर संचेती सर
हेमा मालिनी मला म्हणायचं होतं मीना कुमारी
यू आर माय कॉम्पिटिटर
ट्रॅव्हलिंग केलं एकत्र
With this, let's move on to the next lot. Chandaram Shetty sir, you are one humble person who I have really especially session. Can you mute rest of them? Chandaram Shetty sir, extremely humble. Unmute yourself, please. And you are one man who have actually being a very keen academician, very successful family person, a very powerful and known academician in southern part of our world, and also maintain that style who keenly observes you. You have got that test right from wearing the kind of watch you are wearing, right from having that terrific beach house that you have. Person who would come near you would understand what you are having and still enjoying the best of the academic part of orthopedics, the best of the family life that you are enjoying, and be very content in the life that you are leading. Sir, tell us your secret recipe of being iconic in every aspect of life that you are leading. Over to you, sir.
Thank you. I will present myself. I will present the case first.
Okay.
And then go on to, I prepared the slides accordingly. Then you can ask me any questions if you
go ahead, please.
You do have it. So that I will finish it on time.
Sure.
Okay. So thank you very much, Shushut, for the kind introduction, and it's a great pleasure to see all the icons whom I consider as icons and great people all around. All the 7 of them. I have great respect for them, and I thank each one of you for this great opportunity which you have bestowed on me. Well, I greet from my own university with which I am associated for the last 22 years, and my own institutions I have built with sweat and toil. Well, I will just, what is icon? It's a very, as Dr. Tanna said, it's a very, very difficult word to define. All icons are, all of us, if you see all the 7 except perhaps John, we were born in the pre-independent era. And the PHU research of US, we were called traditionalists. We are called traditionalists. It was the pre-war era or the pre-independent era. And we were patient, we were obedient, and all of us, we worked hard with love, satisfaction, and it was our name of the game. And the next generation, like John, were baby boomers who were achievers. So that was the difference. And then next, after 1961, came the XYZ millennials. So it is a great pleasure to see all our icons being in the pre-independent era, the so-called traditionalists. We traditionals have gone through the transition of orthopedics. Imagine each one of us operating on a fractured both bones of the forearm in a thin lady 50 years ago or 45 years ago, fixed with a Sherman's plate with a wood type of screw with a hand drill. All of us did it and the patient got well. Today, all of us, we do most of the sophisticated surgeries. If not masters, we are indeed good in most of the cases. And we thank God and our patients for the same. I'll just present my short case first, and then I go on to my life. Here was a 20-year-old lady who came to us 4 years ago. She had a history of multiple fractures since childhood, and it was diagnosed as osteogenesis imperfecta. She had one major operation before, and she had 8 fractures which were all treated conservatively. On examination, she had 6 centimeter shortening with a deformity of the left lower limb and was walking with a stick. She could not be married, but with that stick, she would go to the school and then to the college. She and her parents were very keen to see that this is corrected. She went around and she came to us. This was the picture they had 12 years ago. This sweet little girl had 8 fractures at that particular time. And 12 years ago when she was 8, and this was the deformity. And this was she with almost a blue sclera, as you see here. This was the surgery she underwent 5 years ago to correct her right deformity of the right femur. And with this, she came to us. She presented us with this particular X-ray 4 years ago. Look into this femur with the bowing, with the knee like that, with an anterior bowing of that nature, with the coxa vara, and an anterior bowing with the thinning of the bone there. And what are the problems and solutions? Look into that bone. Problem was, it is a 3-dimensional deformity at multiple levels. Number 2, solution, osteotomy at multiple level, and if so, what level? and multiple cora, because there is an anterior bowing, lateral bowing, and a rotational bowing. And the problem of 6 centimeter shortening added to that. And the solution also is lengthening. And is it distraction osteogenesis or anything else? And the third problem is implants. What implant do you use? Is it a plate or a nail or a combination? The problems of plate would be the solution multiple plates, long plates to be used. Distraction cannot be done simultaneously, difficult. Problem nail for a short stature was difficult. And to make a custom made nail with that was again a problem. And as the lengthening occurs, the nail may get buried. So our other parallel thoughts in mind were Coxa at the left hip with neck shaft angle 110 degrees, and that is the anterior bowing of the femur, and poor bone quality, skeletally mature, lengthening or uniplanar orthofix will not give correction of the deformity. And we planned and we put the cora, as you would appreciate, there is multiple deformities, and this was our plan to do 2 osteotomies, but where to do the lengthening. If you do a lengthening in the mid shaft, it is not so it was planned distraction site to be higher side, because if you do it in the mid shaft, it is not a good site for any callus to form. So our plan was a distraction at the metaphyseal site. So with this plan, we did 3 osteotomies, one for distraction at the metaphyseal level subtrochanteric, and in the mid shaft, and again in the lower third of the femur, correcting the deformity. What length of nail to be used we measured, and the length correctly was 360 mm. That suited, and you would appreciate the nail popping out. And we started. This was the immediate post-op, and that the proximal side we started distracting, and that was the distraction. And this was distally locked, as you would appreciate there. And proximal locking site was there, you would appreciate. So the lengthening over the nail with an LRS system was undertaken, and planned distraction site in the metaphyseal region. And limb length was achieved by about 1.5 centimeter. Deformity was corrected, coxa of the hip. And this was the distraction at the 2 months period. You would appreciate it as distracted considerably with the LRS system. With the 3 months follow-up, this was the distraction. And 4 months period, this was the distraction. You would appreciate that as almost it had reached that stage of 4 centimeter. 4 centimeter, we removed the LRS and locked the proximal nail, as you would appreciate there, with 2 locking screws, and it was locked there, where the nail was almost in position. And the length was achieved, the proximal locking was done, and the post-mobilization started with toe touch, walking to full weight bearing mobilization after 6 weeks. And this is 9 months follow-up, as you would appreciate, and this is 4 years follow-up, where almost the length and all the rotational element is corrected. And this was a picture, clinical picture. You would appreciate the scarring on the left side of the thigh, and this was a knee and the hip movement, and this was almost like Ardhasana, where she has almost reached 90 degrees of flexion. And
some trouble, sir, in sharing the video.
No, it is coming. The last one. Yeah, sir.
Fantastic, sir. Very, very great thinking. When we were only thinking of Elizarov at one point in time in Indian orthopedics and not thinking of LRS at all. Can we stop slide share, please? Sir, yes. Quick message, one-liner for the younger orthopedic surgeon before we move on to Dr. Ved Prakash.
No. 1 minute. I have to just finish this thing. 1 minute. I'll finish my message.
Okay.
I have to just.
Okay.
I won't take long.
Yeah, share screen, please.
Yeah, this is a picture. One minute.
Share screen, sir.
Yeah. I just have a message, please.
Okay. What is happening?
1 minute.
You will have to go.
No, these are all the this thing I won't go.
Yeah.
So these are all my what I have achieved. I won't go through. I am not trying to blow my trumpet that I am an administrator. I have been the dean. I have the pro chancellor, vice chancellor of the university, and I have had my own hospital and other things. But I want to share this little poem with you. I was not trying to blow my trumpet too much, but I would like to quote this poem. In this ripe age of 78, I am in fine tune. I know I haven't made a great fortune like many of you icons. But I am not worried anyhow, for I am very happy even now. When I go through the steps of my life, I see I have reaped much more than what I have sown in my stride. Today, gentlemen, I am drinking in my saucer because my cup of joy is overflowing with flair. I thank God, my family, patients, and the friends for this overflowing care. I am indeed drinking in my saucer today because my cup of joy is overflowing with flair. My advice to younger generation is in this COVID days, I've already written a book on COVID, which is being circulated today. Only weapon is discipline. Follow rules strictly. Mankind has won wars against plagues, smallpox, and Spanish flu. COVID-19 has taught us a lesson, gentlemen. Oh man, don't be too proud. We have gone to moon, stepped in the Mars, produced robots and clones. Oh man, shed your egos, be humble. Work hard, don't be after money. Money should come to you. Maintain perfect records of your cases. Attend conferences, deliver lectures. Publish, undertake research. Each patient is a subject for research. Be a social man. Love your family. Love your society. Dream big at any time. Don't sleep till you realize your dreams. All the best and God bless. I would quote these words. Sarve Sukhino Bhavantu, Sarve Santu Niramaya, Sarve Bhadrani Pashantu, Ma Kasit Duk Bhag Bhavit. May all be happy, may all be healthy, may all be prosperous, and let none be in misery. Thank you very much indeed.
Terrific, sir. Thank you very much. Really appreciate that. We move on to Dr. Ved Prakash from Hyderabad, and he has been my host during my Johnson & Johnson fellowship days, and I had the opportunity to see him personally as a human being, very kind-hearted, and as a very classy man, taking me to Taj Oberoi for a dinner. Sir, you have to tell us what made you an icon today. Unfortunately, we have only 8 minutes, you and John, because some of the faculty has to eject themselves out in next 14 minutes. So over to you, Ved sir. Please share your screen and show us your great case which made you an icon. Unmute, please. Slideshow.
Can I go further? Yeah.
Yes, please.
This is my case presentation, Shushruth.
Yes, sir.
These type of cases have been almost, may not be in thousands, but hundreds, which I have dealt with in my now 50 years of practice in India. And maybe 5-6 years in England. Now, this is the patient. His name is Prahlad Patki. I shouldn't mention the name, but then I lost him for follow-up. That's why I thought that I'll put this if he has approached any of my friends' icons. Now, he came from the districts in Karnataka, and from he was operated by the professor there, and that was his fracture neck of femur. Next, no, wait. On the right side, you can see that he came with that picture, and they had not observed the neck of femur fracture. He could not walk even after 1 year. So he approached me. Next. No, go back. Go back. Yes. Here you observe that the fracture was almost uniting, but the reason I found he was not walking was this fracture in the neck of femur which they missed. So what did we do? It was still not solid, so I waited. He came to me after 1 year, and then he could not walk. Next. I did my usual muscle pedicle graft, for which Dr. Kulkarni from Miraj gave me the opportunity to present my cases. And this work continued for me till almost 2010. And I must have done hundreds of cases, really. Next. This was the final result after about almost 7 or 8 months. He was able to walk, and I had sent him home with a brace. Yes, after removing the nail. Next. Unfortunately, he removed the brace and started driving motorbike, and he fell and broke his femur again where it was weak. And this time, this was in 87, 1 year later almost, 1.5 years, and then he came to me. Again, having been operated locally by the same person. Next. This time it was infected. And then what we did is to use an external fixator, remove the old plate, and use these septopol chain beads, which every one of us must have used in those days, in the 80s and 90s. Next. And this was the picture soon after the surgery, 4/3/89. He had his neck well fixed, and the fracture started uniting. We had kept this thing for a long time. Next. The septopol chain was removed after almost about 2 or 3 weeks, but we continued with the fixator. Yes, next. This is the final result, which is almost 2 years later, after 87. And he was started to walk, but was left with a shortening about 1 3/4 inch, which I wanted to lengthen. Next. He disappeared from my follow-up, and if anybody else has seen that case, I would like their input. What happened to him? he was walking and went back to his work. I couldn't get a new picture of him walking.
Sir, I mean, those days when ipsilateral neck and shaft, which we missed them, and almost 20% patients who had shaft femur, because we did not screen their hip and knee the same time, were supposed to be missing those days.
30% and more.
It's a great lesson for we orthopedic surgeon to keep in mind. Thank you very much, great sir. We really appreciate that. John, you are ready with your
yeah, I think I'll start with the case if that's okay.
Yes, you got 4 minutes and then we can talk.
Yeah, it may take just a bit longer than that because it's not planned that quickly, but I'll try and be as quick as possible.
Please.
There are actually, there are two cases. One is really brief because since you wanted one which was very in the very beginning of my career. Okay, so this was a 40-year-old gentleman who who had a motorcycle accident. He was actually initially managed in another state with initial debridement and traction. This was the initial X-ray, but the wound got infected. He started deteriorating, and then he took a 24-hour journey and came to Patna. This was almost 11 days post-injury, and by the time he reached us, he was in septicemic shock. His pulse was thready, he was weak, and he had gross infection locally. So it was a question of what to do to save his life. So we did initial fluid resuscitation, gave him blood, and as soon as possible, we actually took him to the OR. We did a full debridement, and we actually did an open reduction and plating even in that infected situation, feeling that we really had to stabilize this fracture to stabilize the patient. Okay, and in those days, this is in 92, I think it was just a week after I returned from the UK after my MCH. And this was considered really something which no one would do. It was criminal to plate open fractures in those days. But I felt that was the only way to save this patient. We were able to resuscitate him. He got well. He healed his fracture. And since then, he's continued to bring patients to me every now and then, all the way from the state that he belongs to. And this is in 99 that we finally removed his plate because he had developed a slight discharging sinus, and he still comes every 2 or 3 years with a patient with me to come.
Very brave, John. Absolutely.
So that was that initially, which was something out of what people were doing in those days. And this is the next one, is a more recent case and a more complex. And this is the initial video that was actually on YouTube. That gentleman that you saw initially, I will talk about it. So that was the grandfather who was riding the motorcycle, and then they started hearing this cry from underneath the truck and found this little child lying under the truck, and that's what his limb looked like when he went to the hospital, and they're taken a photograph there. So they put on an external fixator, and he came to us about, this was the initial X-ray that they had, and with the external fixator, he came to us about 10 days after the initial injury. They also had these wires down here. And obviously, this was all exposed. His opposite leg was not fractured, but his entire skin was degloved, as you saw in the clinical photograph. So we had a difficult situation here. We had to excise a bit of bone. We put an Ilizarov on, excise that bone. The problem was all this area had no muscle, no skin, just part periosteum. Luckily, because it's a child, he got some granulation tissue. We put in bone graft. Skin graft over the granulated part. Then we realized that his knee was completely unstable, and we had to extend the fixator across the knee. So that was the initial management. Then we had to plan the defect correction. We decided to do a fibular transport because there was no way we could do the corticotomies through the type of skin that he had in the proximal tibia. That was the fibular transport. We got it to dock. Reduced the fixator, got it to heal, put him on a cast. This was him once the fracture had healed. The problem was then he developed this severe deformity of his lower leg and ankle region. So we had to now deal with it, working through areas of skin which were not very great. So we planned to do a osteotomy or corticotomy at a different level where the skin was okay, not quite at the deformity, using some of the principles of deformity correction where you do your corticotomy at a different level from the deformity. That was him once we had got the fixator out and the deformity corrected. This was him, a follow-up about 4 months ago. He was able to walk, got some, and he's just sent this video today on WhatsApp. He's walking quite well. I mean, it's not perfect, obviously, but we've been able to salvage his limb, and you can see from that last clinical photograph what little muscle, etc., he had left in that leg. But he's happy that we've been able to salvage his limb, and he's got a reasonable function with a reasonable range of motion in the knee, not a full range of motion. So two different situations. One sort of where the treatment was just one short debridement and fixation, and the other a more complex sort of thing where you have to plan your whole roadmap for your treatment. And when you have to do this, it's important to communicate that multiple procedures are going to be required in the management of the patient so that the patient understands it and is not surprised when you tell him that he needs another surgery. Yeah. Okay, so I think I'll stop with that.
Terrific, terrific. Great two cases, and I'm sure these two cases with two different messages will create a huge impact in over 2,500 orthopedic surgeons right now listening to all of you and following you as their Dronacharya and icon in their lives. My quick rapid fire question to you, John, Ved Prakash sir and Shantaram sir, is with this corona situation, with this changing doctor-patient relationship in our Indian society, would you advise, what would be your advice to your own next generation? Should they be choosing medicine, orthopedics as their career or not? What is your advice to your next generation or the next generation? Shantaram sir.
I have put all my 5 grandchildren into medicine.
That answers the question. Hey, Prakash sir.
So it is. No, I would advise anyone who has a liking for medicine should take up medicine, and orthopedics is a great specialty. Take it, and if you work hard with discipline, you will be like all those. Except me, all those.
We are worshipping. Ved Prakash sir, your answer to this question.
My answer to this is the next generation should qualify to become a medical person, and for that, what you need is a good parental background with a spiritual bent of mind. And they should prefer their profession over the money. That is highly important. And if you find a right candidate for that, then only you should take medicine. And orthopedics is, of course, some time back when I was a young man, I was thinking, if I die today, what would I like? So I used to think that I will come back again as an orthopedic surgeon. But today, with my spiritual background, I feel that you are not born once, you are born many times, and there is a proof for that. So you have got to have done a lot of good work before you have achieved this life. And the life has made you the icon, you have not tried for yourself. And I feel the youngsters, if they want to become orthopedic surgeons, they must first have a general surgical background, and not only the general surgical background, they must work hard, really hard, before they start on their own.
Okay.
I never had the opportunity of being a professor. But I have worked under the professor, which my chief was Srinivas professor, and he was my icon when I worked with him. Professor Mike Pilcher, who was doing scoliosis surgery in the 50s and 60s.
Thank you, Ved sir. Bouncing back to John. John, you're in the same shoe, or rather, I'm in the same shoe, like you, father and son. Big father became Mukhopadhyay, who was, instrumental in starting orthopedics in our country, and we all worship him. So, John, what was your difficulty, and what's your message?
So I think, first to the question that you put in about the younger people going into medicine, I think if you have a passion or an interest in medicine, certainly you should do it. It should not be something that you're pushed into by your parents or society or something like that, because that's where you have problems. Just because your father is a doctor doesn't mean you must do medicine. It must be a inner calling and a passion for you. I think no doctor has a problem making a living, but don't expect to be making a fortune out of medicine. Set your goals right. And if you're sincere and you work hard, I think there is really no reason why you will not succeed in your profession. And I still consider medicine an honorable profession, whatever the problems with the press and politicians, etc., might the problems that might have been created by them. Coming to having a very famous father, I think one of the things that you need to keep in mind is not to, so you should not let it get into your head that your father was such a great man and I have to compete with him. I think you have to have your own goals. You have to strive for excellence, and then I think for me, I never tried to replicate what my father did. It never was a problem for me that he was considered a great person or whatever. I was really interested in getting my patients better and bonding with them. And I feel your patients are eventually your greatest referral center or system. And that's what's happened to me with my life. I've just worked through patients. Patients have been referring their relatives or friends or whatever when they have an injury or a problem to me from whatever, almost the entire Northeast region, etc.
Perfect, John. Thank you very much.
Sushruth, I have a small comment on John.
Yes, sir.
A small comment. His father had been to me in Mirrors and for an inspection on DNB or something. I had asked him he asked me how is everything okay with children. I had that time I had told him that you have a son who will surpass you and he chip up the old block. That time I had told him, and John has proved that. John has
I don't think I've surpassed him. I honestly don't, because he had many other facets to him, and
I know
academic.
I know.
He did a lot of things in his life which I haven't done, but I'm happy with what I've achieved.
No, you have done a great job, because I know alone how can you be a specialist in pediatrics, how can you be a very specialist in trauma and many other things. This is great, John.
Thank you, sir.
Thank you very much. So with this, let me wrap it up. I have been Eklavya for all of you sitting here, and it's a great opportunity which Emcure has given me. Samar Ghosh, thank you very much for this opportunity, and Subbu for putting this together, the technical backup. I thank and respect all of you. Thank you very much for being here, and I appreciate spending the time and spending your thoughts and igniting the minds of young orthopedic surgeons who are listening to all of you. Thank you for venturing and trying to poke in your personal lives also, and allow me to do that. I appreciate the time once again, and see you soon somewhere. Appreciate.
Thank you very much. Thank you.
See you soon somewhere. Take care. Bye-bye, all of you.
Bye-bye.
Thank you.
Okay.
Sir, just a 1 minute, sir. I would like to share the vote of thanks on behalf of Emcure Pharmaceuticals Limited. We thank you for providing us an opportunity to collaborate for such a wonderful event today, sir. A special thanks to our moderator, Dr. Babulkar sir, for designing such a magnificent interaction with all the icons. I also extend my deep gratitude with the highest respect towards all the icons of orthopedics for sharing their journey and pearls of wisdom to all of us. Thank you to all participants, and I assure that we at Emcure will always be happy to collaborate such activities and look forward for the same. And as a token of gratitude to all the COVID-19 warriors, especially doctors, Emcure has developed a video with a Bollywood singer, and let's watch that. I hope everyone will like that music, and with that video, we can officially end this program. What to you, sir?
है जात धर्म क्या सभी का ख्याल रखते हो, बस लक्ष्य है सेवा, सेवा से कभी ना थकते हो। नहीं जान की परवाह, निकले हो जान बचाने को, तुम रोक ही लोगे आंधी जो है आने को। शुक्रिया भारत के योद्धाओं, एमक्योर करे सलाम आपको। शुक्रिया भारत के योद्धाओं, एमक्योर करे सलाम आपको। कैसी ये जंग है, पड़ी मौत सांसों के पीछे, बने तुम जो मसीहा, जगी जिंदगी में उम्मीदें। वहाँ वीर खड़े हैं उन सरहदों की रक्षा में, यहाँ आप डटे हैं इंडिया की सुरक्षा में। शुक्रिया भारत के